You will see this little device. We also do a spirometry. A lot of employers request that their employees have a breathing test done. Retina Health Healthcare Services and Training Center also offers pre-employment breathing tests and respiratory screening. Healthy breathing is always the goal, as some employers require that their employees have a breathing screening prior to employment. These are for jobs that are in hazards and industries that has chemical uses, and those material may be deposited into the lungs. The employee or the prospective employee will get a test done at the beginning to find out their lung capacity, how easy it is for them to breathe air in and out. Throughout the duration of their employment, they will routinely have a test done just to measure if there have been any effects negatively on their lungs while working there. All of our tests here at Retina Health Healthcare Services and Training Center are performed by licensed, certified healthcare professionals. These tests are to monitor the employee during the duration of their employment. The most popular test that is done is called a spirometry. It is the most common pulmonary function test that we perform. It measures the air volume breathed in and out. It measures the force of vital capacity. It measures how much air volume is expelled in 1 second. That's why it's the FEV1. How much force expiratory volume can you have in 1 second? Then we do a ratio that measures the relationship between the force of vital capacity and the FEV1, which is the force expiratory volume. We use these tests to determine and make recommendations. We here at Retina Health Healthcare Services and Training Center do not share the results with the employer. However, we just make a recommendation of the results, but we do not share the actual test. If the employee or the worker or the prospective employee wishes to share his or her test results with the employer, that is up to them, but we do not share those results. Those results are confidential. We also, before performing the test, we do a healthcare questionnaire. And what that healthcare questionnaire does, it asks a few questions of the prospective employee, patient, or worker, whatever, however you want to refer to them, about their history, smoking history, previous exposure. And the answers on that questionnaire, sorry, will determine what test we want to perform. Some basic prospective employees just get their basic spirometry, but others will get a more extensive test depending on how they answer those questions on the healthcare questionnaire. During the test, the prospective employee will have a nose clip placed on their nose, and they will be asked to breathe into a little device. We use several different devices, it's handheld devices, and they will be asked to breathe during the test. We'll place the nose clip on to ensure that the air does not exit through the nose because we want all of the air to exit through the mouth into the device for accurate measurements. We do the test several times, so we may repeat 3 or 4 or 5 to try to get the best results. Some of the reasons why we have to repeat the test 2, 3, 4 times is because at first the employee may not get the grasp the concept and they may not be able to perform the test accurately. So, like we say, practice makes perfect. So, after the first, second time, they don't get it. We repeat it until they get the hang of it, and so we can get an accurate result. There are some things that we ask the prospective employee to do or not to do prior to the test. We will ask them not to smoke if they can, at least an hour, hour and a half before the test. We would ask that they do not do any extensive exercises because we don't want them to be tired. and the test results will be erroneous because it will look like the person has decreased lung capacity when actually the person is tired. We ask for them to wear loose fitting clothing so they can be relaxed. And we would ask that they do not take any medication that will affect their breathing. But if there is medication that they should take, that they have to take, they can go ahead and take their regular medication. That doesn't affect their breathing. And then we do ask them to please let us know what medication they have taken so we can notate that to see if the results are affected by what they took earlier. The bottom line is that respiratory testing is nothing to be afraid of. A lot of people call us up beforehand and say, what does that mean? What do I have to do? Just a simple breathing test. It's a simple breathing test to measure how much air you're moving in and out of your lungs. Um, we let the employee know that this is for protection from them as well as for the employer, because the employer has an environment that they have to keep their employees safe.